Tara Ernsky. I am a registered nurse, and I have been a nurse now for a little over 4 years. I never suspected I had cancer at all. I didn't think it was a possibility. I just went in for my yearly gyno exam, and then during the breast exam part of it, my gynecologist kind of stopped and just was like, have you ever felt that before? And I was like, felt what? So she just said that we should just get a baseline mammogram, and the mammogram didn't show anything. So then they had me do the ultrasound, and the doctor came in and told me it was definitely not a cyst, and that's kind of like when I had that first kind of drop in your stomach feeling.
So Tara is an amazing woman. So she came to see me, she's 30 years old, and her gynecologist had felt a mass. And so it started down the path of working up this mass, and she already had a mammogram and an ultrasound, and then we ordered a biopsy.
Dr. Kripe called me, and I knew the moment I answered the phone. He just said that we got your results back, and he said, I'm sorry, but it's not the results that we were hoping for. And he kind of told me that, and I went right into it, that it did come back positive for breast cancer. And he's like, I really think we need to get your MRI done, and then let's have a family meeting. It was stage 1, grade 2, invasive ductal carcinoma.
And then we had a meeting with her and her boyfriend and her family, and really sat down and talked about all of the different options.
He gave me a copy of all my results from my MRI and from the ultrasound.
Here, dense breast tissue, and what you can see, there's a triangle marker.
And then he showed me just all the different angles and then presented the information.
Really, with breast cancer, there are a lot of options. It's not just a one-size-fits-all. We're hearing of a lot of younger women desiring to remove both of their breasts. It does not help with survival, but at the same time, there's so many years to live that a lot of women just choose to do that.
When I decided that I wanted to do the double mastectomy, we just said, okay, it's a go, this is what we're gonna do.
She had a great surgery, everything went very, very well.
I really did my best to listen to what Dr. Kripe said. He said 6 to 8 weeks, really try to take it easy. Around those times it was, pretty uncomfortable, and I would really tell myself, okay, don't do this. From day one, I told myself, I am just gonna be very positive about this. I told myself I would have at least once a week where it was okay to just tell myself that it's just unfair, and it's to cry and to allow myself to, just have that moment of feeling sorry for yourself, but then I would turn around and, be positive again. When I come in for my appointments and my consultations, the first question is about me. How are you doing? How are you feeling? And
Hello.
Hi.
Good to see you.
Good to see you. It's not so much about my diagnosis and what disease and what I'm going through. It's about just me as a person. And I really appreciated that, because it isn't just you that's going through it. I mean, even though I'm the one with the diagnosis, my whole family and loved ones are involved as well. I cannot say enough words to them of what they did for me. Thank you for taking the cancer away from me.